we have a workshop about introduction to review research with a special emphasis on narrative review. You can learn about its important at UG level and also about some important software techniques in the review literature. So today we have with us Pratyush Kumar from 3rd MBBS, BSA Medical College, Delhi. Welcome, Pratyush. He is the associate editor of review research publication for this year. He was the editor of review research publication for previous year at Journal of Asian Medical Students Association. He is a part of research team of International Consortium of Clinical Students Organization. He has 4 publications, 10 research projects, 5 presentations, and 9 conference delegations to his names. Over to you, Pratyush.
Okay. Thank you so much for the wonderful introduction, Arya. It's been a pleasure being here with Aspire and all the enthusiastic participants who have joined us today who wishes to learn about the review research and specifically in context to narrative review. So first of all, without much further ado, I would like to give few points before starting the sessions. I really wish this session to be interactive. So make sure you keep the chat box interactive. You keep on asking me and putting questions and asking me even the silliest thing which comes across your mind. I'll be really happy to answer them. At the same point of time, if you wish to switch on your video camera, that would also be appreciable that you are listening. And I'll also logged in via another device to monitor the chat so I can reply to your queries whenever. So I'll start sharing my screen. For today's session, I'm going to give you a brief overview about literature search, how to actually conduct a productive literature search, and then more and less my final topic for today would be narrative review. So here I am with the help of Aspire, the research club of St. G.S.M. Hospital, presenting on narrative review. The presentation outline. In today's session, we'll be discussing about an introduction to review research. When it comes to review research, it's pretty much different because specifically speaking about the Indian scenario, when you talk about the research to any colleague or even to a faculty, they believe you're referring to an original study. And specifically at UG level, like research is equal to an ICMR project, more and less. But the fact is that if you wish to explore and you wish to gain publications and do research and present it, you have to know the wider aspect of it as well. And the first topic would be that. Then we'll go to the basics of literature review, the ideation of a narrative review, what should be a basic structure when it comes to writing a narrative review, the SCNERA checklist, which I really wish to talk about in detail, the referencing style, procedures, and finally ending it by a Q&A. So first of all, now, as I just told, if I speak to you, if you were to any UG student at India, that please would you like to carry a research project, or if they tell me that I've carried a research project, there is a very common assumption that it is an ICMR project. But when we delve into the depths of research, there are actually 2 types of broad categories. There are all those smaller categories, but the 2 broad categories would be an original research and a review research. So like the definition, I'll just go through the definition first. So it says that a review article or a review paper is based on some other published articles. It summarizes the existing literature on a topic as an attempt to explain the current understanding of the topic. Now, it's crucial to understand that what exactly refers to the word review research. Even in original research, if you have ever written a proposal, you have to do a thorough literature search to, and give references and add all those things. Then why is review research different from it? So I have 2 images on my screen right now. The first one, it shows a magnifying glass symbolizing research, and there is some process going below, some sort of process represented by the symbol. In a review research, there is a manuscript, right, which has already published and already thoroughly researched topic under it. Now, the difference is that in an original research, you're actually researching on something which is going on or some intervention. For example, you take a study population, you are giving them some intervention and you're seeing them if it is useful or not. And that's a higher level of research. Let's come back to what usually everyone does. They make a Google form, a survey, and then do a CAP study, that is knowledge, attitude, practice, and then survey, send it across, get it filled by students, and then show the results that these many percentage of students believe that, these many % of students know about that, and these many % of students practice that. Now, this kind of research is an original study because there is a population and there is a data which you are collecting from that population, which could be regarding to anything. And that is why it's an original research. It's not like review research is some sort of fake research and not, not original. But the thing is, in an original research, you are doing it right from the scratch. You are collecting the data right from the scratch, and you are processing the data. You are analyzing it to give some conclusions from that study population on which you have done the research. Now, I'll just give you an example. For example, let's take COVID only. In COVID, suppose I'm at a hospital, I'm a good doctor at a hospital, and I have 100 patients of COVID-19, and I'm giving them some drug or some therapy like it's hydroxychloroquine or plasma therapy. And then I'm analyzing out of those 100 population, like plasma therapy was effective on 70, was effective on 60, or whichever result comes. Now, in a review research, what I'll do, now this study I conducted at my hospital, let's say XYZ hospital, or let's say SAGS. I conducted this at this hospital. Now I'm using plasma therapy as an intervention. I'm using the COVID-19 positive patients at my hospital for using that intervention, and I'm collecting the data. Now the same thing, plasma therapy has also been utilized at Delhi for testing on some patients. It is also utilized in West Bengal or in n number of states in India itself. And why only India? Beyond India also you'll see a lot of hospitals researching on plasma therapy, giving it to patients, and then seeing how many patients are showing a positive response. Now these studies are conducted at different levels at different places. Now what does a review do? Suppose I just want to know that if plasma therapy right now as of 27th of July is useful or not. Now, I cannot refer to those 100 articles or those 100 studies conducted at n number of places to know, because some studies would say it is useful, some would say it is not. So what does a review do? It is like a funnel. You put all those researches into that, and it is going to give you a final conclusion. It is going to give you a conclusion based on that all those studies conducted at different times, different places, that right now, as of 27th of July, what is the main crucial highlight of it? Is plasma therapy useful? Is plasma therapy not useful? Now, I have given you the example of this, which is conducted abroad also. Now, there is one important question which raises here. You all know by physiology and by your biochemistry knowledge that there is always some difference when it comes to some races and the demographics. So, would a review which is conducted on a population considering to Western world or some other continent would not be much applicable to the Indian population? So, if I'm doing a review on plasma therapy in the Indian patients, I'm going to focus on all those RCTs which are conducted within India, and that particular topic, that is in this case is plasma therapy and COVID-19, and I want to give a one single conclusion based on all those studies. I'm going to refer. So refer is an important term because reference is what I'm going to give in my paper, that from this paper says that it is so data and it is effective or not. This says that, and then finally I'm going to give a conclusion. So this is a broad division of an original research and a review research. Going ahead, it's just a summarization of all the points. In an empirical or non-original study, it is a report. Usually, it could be a lab or in hospital experiments or interventional studies, which has an introduction. It has a material and method. It has a result, and it has a discussion. For example, COVID plasma therapy was used in COVID for so. Hence, we want to investigate it in our place. The method, how I'm going to do it, the doses and everything is going to come in that, the results, and then finally discussing it. While in a literature review, you have to actually evaluate the material which is already published. So how do you go about it? Firstly, you need to define a problem. Now, for example, in this case, like as you have seen that there are very latest updates coming up, some drugs were started in COVID-19 in the standard protocol, then they were getting removed. So how is that happening? Researchers are conducting at different places, and a final summary is given that from all those studies based on some sort of reviews, although those are higher part of review, which I'm going to cover in my subsequent slides. So if you want to start with a review research, you have to define a problem or clarify a problem. That problem could be, is HCQ effective in COVID-19? Or it could be even you want to talk about the pharmacological managements of COVID-19, or you want to talk about some sort of prophylactic measures on COVID-19. summarizing everything which is published there on the internet in the scientific databases into a single review. That is summarizing the previous investigations, identifying the problems or gaps in knowledge, and suggest next steps subsequently. There is no physical research done in case of a literature review. So this is very important point in which was the last statement. There is no physical research needs to be done. So that is the reason that a review research, or specifically a narrative review, is the best start if you haven't done a research project previously. Why? Because you'll get to know how to write a manuscript. You'll get to know the scientific writing skills. You'll get to know the art of literature review. You'll get to know how to understand different studies. And once you have that knowledge, you'll be able to formulate an original study or an interventional study on your own, because you'll have some background knowledge and experience in scientific research. And as there is no physical research needed, for example, this is a time of pandemic, a research project right now mostly is consisting of getting survey field researches by Google Forms. But if you wish to do an interventional study, that might be difficult at this time. And that is the best thing, that a no physical research is needed in a literature review. All you need is is an internet connection, is a scientific databases which are already present there, and you need a device, a laptop or a mobile phone, or preferably a laptop, because I'll be teaching you a few points on how to go about it. And then all you need is your devices and connections to do a literature review. So you do not need any sort of interventions, any sort of funds, or any sort of, I would say, very costly equipments or anything that short. All you need is a will to do research, which is very, very important, even if you're doing a review or if you're doing an original study. So those will be the three things you have to carry: the will, internet connection in between breaks could be fine, but so you can access the databases, and all you need to do is search it and portray it. And that is why it's the first best thing to start up with. It would also give you an insight about manuscript writing. We're going about the basics of literature review. So as I told you, you have to search articles which are published. Now, where are you going to search? So you are going to search in the databases. That is, namely, the most famous ones are PubMed, Cochrane, clinicaltrials.gov, Embase, Sinhal, and Trip Medical databases. Apart from it, there are many more, databases which you can search it, but these are the very commonly used. Now, when you go to these databases, if you are you have just started, using these databases, you'll actually go crazy. Or you search one term, you search COVID-19 plasma therapy, lakhs of paper would come on that. So how are you going to read lakhs of paper to formulate a single manuscript? Then you'll say it's more difficult than an original study. So we just have to make a Google form, get it filled, and even I can do that. But in this, I have to read lakhs of study. You actually do not need to read lakhs of studies. What you need to do is be a little vigilant about these search terms and applying filters to get those studies which you want in particular. Now, I'll give you a demo of these search databases, a small demo to go about it. And I'll also talk about each of these points. For example, now if you go to PubMed Advanced Filter, you go to the PubMed website, there is an option for Advanced Filter. There are few, this is something what you're going to see. Now, there is one option where it says add terms to your query box. It says all fields. If you click in that option, you will get options if you want to. So it's basically like a very advanced search, where if the terms which you are going to search, like you want something, you Google it. So how you Google it? You put terms. So similarly, you have to give terms, but you need to know that you need to tell PubMed if you want to search those terms within the full text, within the abstracts, or sometimes author names or something related to that. Author names are usually never not searched, just usually searched if you wish to, in case of systematic reviews and meta-analysis, if you want to see if that same author has done a advanced study or a follow-up of the previous study. Right now, the most preferable would be an all field, so that you do not miss something on the internet. Then you see that option of add. If you click on this arrow, you will see and, or not. From the basic English, or means either this or that, and means both of them at the same point, and not means that this but not that. For example, now how do you use these search terms? So now I put COVID-19 and plasma therapy, and I clicked or. Using this arrow, I went and I clicked or. The search results are 4,81,327. Not humanly possible for you to go through each one of them and go through 4 lakh papers. If you can, you are probably either a robot, or you are some sort of very genius from your brain, and you are using some sort of intelligence, artificial intelligence, because going through 4 lakh paper, you'll either fail in your MBBS, or you'll I'll end up banging your head on the wall. So what you have to do, you have to be vigilant. Now if I click the preposition and COVID-19 and plasma therapy, because it makes sense. If you wish to know about COVID-19, or if you're typing COVID-19 or plasma therapy, there would be papers which are about COVID-19 but not plasma therapy. Now your review is focused on COVID-19 and plasma therapy, basically plasma therapy and COVID-19. So technically, all those terms should have been used. That is, where studies which contain plasma therapy also, which contains COVID-19 also. And I have to only go through those studies, which are approximately 1,766. Still good to go. But still big, a bigger number, but still, at least it's better than 4 lakh papers. But now there is a high possibility, if you're going through such a filter, is that you'll miss some of the study which does not use the term COVID-19, but use the term SARS-CoV-2 infection, or use the term coronavirus. So this is where the OR filter comes in. Either the paper contains COVID-19, or it contains SARS-CoV-2, or it contains coronavirus. Any of the 3 terms could be contained, and it has to contain either plasma therapy or convalescent serum therapy, and there would be more ORs. So you use the OR filter to add synonyms of the same term, like COVID-19, SARS-CoV-2, coronavirus, and now you see the number increase to 2,459. So it shows that if you had used these search terms, you would have missed papers which use terms SARS-CoV-2 or coronavirus, and then that would have decreased. You would have compromised with the quality of review which you are doing. And this is a way how you properly frame a search query and use it to get the most number of paper. Now again, this is a very big question. How are you going to read? You'll ask me, how will I go through 2,459 papers? Once you do the search, there is a filter on side of PubMed. I don't have their screenshot. I'll show you a small demo of it just after this, where you can click it and you can select the type of papers which you want to read. Now, are you going to select that paper? If in case of plasma therapy, you want qualitative data or quantitative data. Qualitative data is that some sort of plasma therapy has been found better because of these reason. There is other following side effects. This is qualitative data which has been researched. Quantitative data is, there is an RCT which says out of 100 people, 60 were benefited, 40 were not benefited, and something like that. That is a quantitative data. So if you wish to add the quantitative data in that subsequent paragraph, you'll prefer to go by the filter of RCT. Just sharing you a small demo of the same. So I went through the advanced filter. I use this search term only. I'll add this query and I'll search it in the PubMed. Now there are 246 studies and I want to only use the filter. Suppose I want to go through randomized control trials. I go through one of the trial, and in one of the trial, if you actually go through this trial, you'll find in the abstract itself, you'll find an abstract which will give the data that 103 patients were there, these were benefits, and some the following had side effects and everything, which you can go back in the document you're making and summarize it. Again, you do not need to go this is a benefit when you're searching. You do not need to go through the entire study. Firstly, you can read the abstract and find out if what is mentioned in the study, because abstract is a summary of what the paper is about. So you'll get to know what this abstract is about, why the abstract, what this paper is about, and you can find out if that paper is relevant or not. So you need not read the full text of all the papers, but you can screen the papers based on the abstract which is given. And as you can see, it's a small abstract, you can easily read it. So this is something which is a humanly possible work. Going through these studies, there are only 62 studies, RCTs. Now the thing is, if you want in a review, you always want to give the most recent update or what is the current understanding. So would you like to get an article of some years back, or you would like to get the latest studies? So you can also use the publication date or the custom range features to identify the time. So how does that happen? So it happens via that. Yeah, I hope my screen is continuously visible. If there is any problem, you can just put it in the chat box so I can help through it. So you just put it in the chat. So you just put the filters accordingly. Now, for example, plasma therapy must have been, what is the use of the publication date thing? So the thing is that, plasma therapy must have been used in previous viral infections apart from COVID-19. Now, COVID-19 was sometime in towards the end of December in 2019. It was there. Now, would you like to have those studies in the list, or you would like, it would be a waste of time to going through those studies which is using plasma therapy, but is for some other viral infection, some other maybe even beta coronavirus infections, right? It could be about some beta coronavirus infection which is not COVID-19. So you would not like prefer to add that. Okay. I'll yes, Mrigan shall answer your query. How to select the paper. So I'm giving you example. Like in the search term, you also used coronavirus. Now, if some paper is mentioning coronavirus and you're searching it, so there is a possibility that some other beta coronaviruses, like coronavirus 90, COVID-19 belongs to beta coronavirus, belongs were in past, and some kind of plasma therapy were used in that. You would not like those studies to come up in front of in the search bar. So you can use the publication database. You can use it to set the time, like after 2019 or something like that, or from December 2019. Now, before December 2019, COVID-19 was not there. So for at that time, you'll use it to get only those studies after December 2019. So only those studies containing coronavirus of 2019, that is COVID-19, is there. Now, the other thing is that it's not like the historical part of plasma therapy you'll not add in your review. A review is like a narration. So when you're narrating, you are actually putting out a story. So how do you put out a story? You do not tell that, you started with there was a king, there was a queen, and some story happening in that past. Similarly, you have to tell about what exactly is plasma therapy, what exactly is coronavirus. So that would be an introduction to your to the body of the paper, that coronavirus, you'll tell about a little bit about coronavirus, you'll tell about plasma therapy. You will not directly say that the king had a war with someone and something like that. You are going to give the introduction to what you're going to talk about. Now, Mrigansh has a query on how do you know that what type of paper should we select. Okay, Mrigansh, you are writing a paragraph, you are writing a narrative review right now. All right. You want to give an introduction to the king and the queen in the story. Narrative review is actually a story, I'm telling you. So you want to give an introduction to coronavirus. So how will you suggest? Preferably, I can also reach out to a review or a systematic review or some kind of books and documents in that cases. Where will you find the history of coronavirus? More preferably in books. And one other way around is, although it's a shortcut, it's not the very standardized method, but it's a shortcut is you go through reviews, you search some other review, and then you find out references from that review only. You'll get all the references from that review, and then you reach via that. And suppose you are writing a paragraph in which you want to give data about how many patients are actually benefited by CPT, then you'll prefer to go with RCT, randomized control trial. So this way you actually define which type of filter you're going to use. Now the other, I'll also talk about Cochrane library. That is, I'll just Cochrane library. Yeah, advanced search. So in the Cochrane library, if you go about, there could be various search options. This is how again the search therapy would be there. You can again text search between all text and the same and or not feature. You search in the title, abstract, or word. You keep your keywords and then you run the search. Like this is the simplest way you can do it. And then you will get Cochrane reviews. You can get trials. You'll get protocols, and you'll get a less number of good quality trials which are there on Cochrane. And Cochrane is one of the very good databases to search. Now, apart from it, there is another way to reduce the total number of searches. That is by using mesh terms. So what exactly is mesh terms is, you go down, you find the mesh subheading or mesh terms. So mesh term stands for medical subject headings. These are terms which are medical. So sometimes these terms are only going to search, and if you use the same query, I'll use it to add the same query, copy. I'll just add it, and I'll add the mesh terms, and then I'll add it, and then I'll search it. Now you will see there are only 62 studies in RCT. And even if you remove RCTs, they are going to come how many? If I'm talking about mesh terms, there are only 62 studies which are going to come. So mesh terms is an advanced way of finding the good quality of papers which are using these as scientific terms. So now with this, I'll come back to I'll also talk about a little about clinicaltrials.gov. In clinical trials, it's more and less about RCTs. You'll find all the RCTs available in clinical trials website. Cool. So this was about it. And then if you talk about other, ways, like in the condition of disease, you put the disease that is COVID-19, and you also get terms to fill, and then you can add plasma therapy, and then you get all the trials of which are done. You can also select country, the significance of selecting country. If you're writing a paper in significance of India, you would of course not to like to get trials which are conducted in Ireland, which are conducted in Hungary, which are conducted in China. So you'll just go there and change the country, that is modify search, and you can just change the country to India, and you can do the trials. And there is no trials right now, which is in the face. There are so many, the trials, 7 trials right now. Also, you would not like to include data of trials which are either recruiting or not completed, so you can also use the filter of only completed trials and apply it here. So there are only 4 trials which are completed in the context of India with these keywords. So this is how you do it. So this was about the literature search broadly. I'll go back to my presentation, and we'll move forward to understand narrative review better. So this was about the literature search. I hope it's clear. If there are any doubts, feel free to put it in the chat box. Now it comes to review research. What kinds of review research are already existing? The first one is a narrative review, which is the existing literature background mentioning the sources of a discussion. Narrative review is more or less like a narration or a story where you are writing and telling about everything. Then a systematic review. The systematic review is that there is so many types of literature present there. You can relate it to your MBBS studies. So sometimes if there is any topic and you are just reading the book like a narration, it might get difficult sometime to understand what's written. It might get difficult to memorize. So the best way possible, which you must have seen, is you tell even your colleagues that read systematically. So what that systematically means is classifying, going through the features, rejecting and accepting articles to only find the limited amount of literature which you want to include. So that is about systematic review, where you do that. In meta-analysis, what you do the systematic review using there is proper guidelines for all these researches. You use the systematic review to get some number of RCTs. Then you do statistical tests on the data which is available from that. So statistical tests, it's a little complicated, and I do not have the entire time to explain that. So in summary, if I say, what you do is you use statistics, that is you use statistics to use the data of all the different kind of studies which are there, and then you use that data to derive a result majorly. For example, one study used 50 patients, 2 studies used 50 patients, some used 49 patients, and the 4th study used 50 patients. In your meta-analysis result, there would be actually, the results should be derived on the basis of results from 200 patients. So of course the meta-analysis is at the top most of the scientific pyramid. That is the reason. Meta-synthesis is more or less the same. It is a qualitative approach rather than a statistical approach to explain the extent on which the topic has been explored. For today, we'll be only focusing on the narrative review, because that's the very beginning of something which you need to do. In a narrative review, it's qualitative. There is not much of there's actually no statistics which you have to do. It's only qualitative. It's a summary and a critique of the literature on a particular topic. You summarize the existing literature to explain the current understanding of the topic. So narrative reviews have no predetermined research question or specific search strategy. It's only a topic of interest. For example, it could be, I'm just saying COVID-19 because a lot number of reviews are being carried out, because it was the most research recent thing which is going on. Apart from it, you just need to find a topic of interest, and then you just start narrating a story on that based on the scientific literature. Also, when you're narrating the story, you have to always keep in mind, you never put your opinions, your views, or your perspectives. For example, you cannot say that I believe this is something like that. You have to only state on what your reference on what the literature says. There are scientific communications in which you have to give your comments, your opinions. Those are called short communications, preferably commentaries or perspectives. In a narrative review, you have to adhere or not putting your opinions and your comments on the same. So you select a topic of interest, you search the literature, you develop an argument about the same, you survey the literature, you go through it, and then you write the review. And more or less, it's narration, it's summary, and it's topic of interest, all which you need. So then moving ahead, I'll go to the next slide. Now, structure of the narrative review. So when it comes to the structure of a narrative review, how the it's the introduction, it's the body, it's the conclusion. 10% of the word count goes in introduction. You have to introduce the topic of the topic on which you're writing. The 80% goes to the body, and 10% goes to the conclusion. So when this 10% goes to the conclusion, it's basically the total word count is somewhere minimum 4,000 words of good narrative reviews there, and try not to exceed around 8,000 words. Again, it depends upon the quality of narrative review, but make sure it's minimum 4,000 words. If you will write a narrative review below 4,000 words and send it to a journal, more and less they are going to if you are going to receive a reply, please consider submitting it to some other categories, like some sort of short communications, right? So in the literature review, you start with an introduction, 1 to 2 paragraphs. You give the context, the importance on why a review needs to be carried on the topic. You give the aim and intentions, you give the scope of it, and you give the key themes. So basically, you have to introduce the topic and why a review needs to be conducted, and what is the aim of your review while you're conducting this. Then the body. In the body, you actually, it's not that you only write one paragraph in the body, like it's written body. Specifically, a good narrative review would consist of a lot of subheadings, and then subheadings of even those subheadings. So it's properly structured, it looks systematic, and it's readable in the sense. If you're just going to write paragraphs and paragraphs without proper subheadings, it might not be so appealing to any reader, right? So you have to expand the key theme. You have to highlight each of the importance. You have to draw some amount of conclusion from each of the subheading. You have to also show the theories and all the materials which you have gathered from the literature, and conclude the body. Then comes the final, that is conclusion, which has to be 1 to 2 paragraphs. Based on all the conclusions of whatever you have written in the body, you need to give 2 paragraphs of conclusion. You need to outline the current knowledge. In the conclusion, make sure you do not put on, based on your review, you believe that this is this. No, you have to just outline the current knowledge, and also identify the areas which are not addressed, that areas which need to be researched upon, so that other researchers reading or review can identify, it can help to identify the research gaps which they can work on. Okay. So regarding the I have a doubt in the chat box. By Mrigan, should it possible to show a sample review paper and compare the points? I'll request if you can. The thing is that there are various kinds of review. I'll see towards the end of the session if something like this could be possible. Apart from it, we can definitely ask the Aspire team to share some of the links from PubMed, or even you can go to the PubMed filter and see a lot number of reviews. Why a single narrative review? See a lot number of reviews from there itself. That is going to be more helpful in my opinion. So moving ahead, the SCNERA checklist. So this is something which is often missed. This is a standard scale for assessment of narrative review articles. You know that in research we have a standard scales for a lot of things. The SCNRA, that is scales for assessment of narrative review articles, is a standard scale which stands for the same. It contains the justification of the this is the entire scale, and this helps the use of putting it here, why I put it here, so that when you have written your review, you go through it using the scale itself, and you evaluate on which part your narrative review is lacking, so that you can work on that. For example, you go through the justification of the articles important for readership. The importance is not justified, and you can also take opinion from your faculties or experts in that field on your review using the scale, so that you'll get an idea on which part of your review you need to work on, and then you work on that review, and then you send it to a good journal for publication, and again the publication process would start from there. So always make sure to keep these points, that I'll go through them briefly. Justification of the article's importance, already dealt. The topic needs to be important. If at this point you're writing a narrative review on HCQ in COVID-19, it's very difficult to get it published or get it accepted, because HCQ reviews are already there out there, and it's HCQ is like out of the list now when it comes to pharmacological management of COVID-19. So something which is outdated, do not try to review it more, until and unless there is some miraculous paper out there which has come out saying that the previous outruling the previous things, and it derives some very useful and very impactful studies. So avoid using outdated things. The statement of concrete aims or formulation of questions. You in any kind of research, you already always need to have an aim. If in your pharmacological management you have an aim to evaluate the best pharmacological management right now as per the current understanding, or in HCQ specific review on plasma therapy, we want to give a your specific aim is to evaluate the efficacy of plasma therapy in COVID-19. That is going to be your aim. Then you give a description of the literature search. So this is very important, and sometimes people miss it. Why? The reason why people miss it, because there is a very thin line between a narrative review and a very scoping review. In a scoping review, you use the Prisma guideline, or it is something in between. The systematic review and narrative review is a scoping review, where you elucidate the search strategy in very detail. And that is one of the reasons why authors usually forget to mention the search strategy in narrative review. But make sure you do so, because that gives the idea to the journal on how you have carried the review, and that way the journal would know if your review was carried properly. And if your methodology on searching PubMed, on your searching articles was itself wrong, again the results and the conclusion of your review is very compromised. So it would have less scope of getting published. And if you are using every detail, using the keywords correctly, using the search terms, as you can see, they are asking for detailed search terms and inclusion criteria. Inclusion criteria would be studies having COVID-19 plasma therapy, and whichever. So that is important to mention, it is in the study. Then referencing, of course, references is something you can never forget when you're doing this. So you always have to keep that in mind. Referencing, scientific reasoning in the article. The article's point is not based on appropriate arguments, appropriate evidence. Appropriate evidence is present, which you have to do. Evidence is again the correct papers mentioned and referenced at every point, such as RCTs in clinical medicine. For example, if you are telling about HCQ efficacy or plasma therapy efficacy, and you are just giving qualitative data, but there is no summary of any most recent RCTs, it doesn't amplify, right? I can say make paragraphs and paragraphs about something, but there is not any specific point. That is just going to be a theory answer, I would say. And even in theory answer, just correlate it to your university examinations, that your faculty always encourages you to give points. No one wishes to read stories, so you have to always incorporate scientific reasoning, scientific RCTs into that. Appropriate presentation of data, again, of course, whichever data you are using, you have to present it appropriate in terms of the relative and absolute risk, the effective sizes, with the without confidence intervals, and everything which has to be presented if you are presenting it in your review. So this is a checklist for the narrative review, which you have to always keep in mind. Then moving ahead to referencing, the correct way of referencing is first including the authors, then the year of publication, then the title of the study, the subtitle, the edition of the journal, and the publishers of the journal's name. So what you can do, you can, when you're referring a study, you can manually take it out. Like you read the authors, then you put it, then you add the year of publication, you add the title, subtitle, you find the journal and you add it. So either you can manually write it, or you can use softwares like Zotero and stuff like that. So Zotero is one of the softwares. There are a lot of softwares. There is EndNote, X9, there is Zotero. Then there are other searching softwares as well. One good example is Zotero, for which example I have added. Like there is one icon of document, if you can see here. I'm reading this article, effect of convalescent plasma therapy. I click on that, it gets saved to my library. It gets saved to my Zotero library. I go to my document, whichever document I'm writing. At that place where I want to reference it, I just need to there is an option of add link Zotero citation. You go there and then you add some keyword of that. For example, if you have add effect, so you'll get your paper effect of convalescent plasma therapy, which because it has been added to your library. You click on that and Zotero gives that number and also the bibliography automatically. So this is the automated process of referencing, and which is more convenient rather than a manual conventional method. So this is more and less about the narrative review, which I've discussed in detail. And now is the time for Q&A session. I would, of course, if you have any doubts in the presentation, or if you have any doubts, you can reach out to me by my email address. You can reach out to the Aspire team, and I've added my email and Instagram for the same. If you can DM me, and you can reach out to the Aspire team if you have any question for regarding my presentation or the narrative review. And now is the time for Q&A. So I'm actually waiting for some great questions to answer in the chat box. So please feel free to put anything or anything you want to talk about and ask me. So anything related to the review research, and anything related to the narrative review, or any questions you want to ask me about it. So feel free to put it in the chat box. I'll be happy to answer that. We have all brilliant students here in the session today.
Thank you, Pratyush. The session was indeed fruitful.
Thank you so much, Arya.
Yeah, most of the doubts which may have arisen in someone's mind must have been clear.
Yeah.
The floor is open for the audience. They can ask any of their doubts and queries now. Yes, sir, you can unmute yourself and
Yes,
ask
yes.
the doubt.
Please unmute yourself and ask the question.
So just wanted to ask that after the search result, they were given 2,600 articles. So how to proceed with those 26? Matlab, if we cannot go further or advance search into those, so how to read those 2,600 articles?
Okay. Yeah. So, how do you do that? It depends upon what you are writing. Suppose, just give me any, I'll sure deal with all sorts of, things. For example, if you're writing the introduction, so, you can refer some old paper or some sort of review, which will give you sufficient information. And specifically, when you're doing a narrative review, you need not go through all the 2,600 articles. You need to go through only the latest ones, right? And you can arrange it in that way. Another way is, you import all the citations into a software and they arrange it based on the publication date, right? And secondly, Megansh, I would suggest you, now suppose you're writing about a paragraph about if plasma therapy is useful and you want statistical data. So you just search the initial RCTs and you add it. When you're writing a systematic review, it is absolutely and absolutely necessary to go through each referencing, because that is a systematic review for a reason. In a narrative review, as long as you get sufficient information, as long as you get sufficient data, you need not you need not get it go through all the 2,600 articles, only the relevant ones, only the latest ones, because again, a narrative review is about the current understanding of the topic, right? I hope I was able to answer your question.
Yes, sir. Thank you, sir.
Okay, now we have one more question in the chat box. So, do we need to have a guide for review paper? All right. So, this is a really nice question. So, firstly, you need not have a guide to write a review paper. All you need, as I told, was a will and a little bit of scientific experience in terms of searching and everything, and at least start with it. But of course, if you're new into it, you'll need some experienced person in terms of a guide to proofread your article before you actually submit it to a journal, because again, someone experienced in that field would be able to give better inputs on that. Like, if you of course you can write it, you need not take any ethics approval for any review. Like, in terms of a narrative review specifically, you can just inform your faculty. And even to be honest, you do not need a faculty to write it. But it creates problems sometimes, because when you're submitting to a journal, they also see the qualifications of the author. If you have a if you're writing a review on COVID-19, if you have a MD medicine or a microbiologist on your team, based on what you're writing, there would be high chances of getting it published, because the journal would think that there is some expert involved into it. So it's just a guide might be needed, or a guide might not be needed, but you might need their help, or technically being an expert to get it published. It will be easier to get it published if there's a guide. Of course, student journals would be happy to accept a narrative review, but it depends if you want to get your articles published in a student journal for starters or not. Student journals, in my opinion, would be happy, but again, I would really really recommend to have someone experienced to proofread your article once, because again, we all are students and we all are learning. There should be someone to proofread our articles. Now, Sneha has a question: how likely is that a narrative review from a UG student is accepted? Because they are generally requested from experienced faculties to write up. If you want to ensure a narrative review paper getting accepted, what are the key points to keep in mind? All right. So the key, see, on a very practical note, Sneha, if the quality of the review which you have written is great, then it can get accepted in the journal also. Now, how do you make sure that your article is great? Choose a topic on which there is limited literature available. A topic which is not discussed, some XYZ topic like it was a very general topic which I was giving, plasma therapy and COVID-19. A review on this is little difficult to publish, of course. Choose a topic like something of a some like you must have seen on internet or sometimes in the searches it comes that a study has concluded that this has a neuronal regeneration, some kind of thing, or some kind of very rare procedures which are being carried out. And search, firstly search, there is no review on that existing. Search that there are no systematic or meta on that existing in specific, because if there's a systematic review the chances of narrative review would be difficult. But more or less journals accept it, because again that's a section which they have to publish. And apart from it, experienced faculty, so get experienced faculty as a guide for your study. So again, as the same doubt I was explaining, to understand or to get a narrative review published, it would be better if you are having someone who is experienced in that field associated as in the authorship or is in the guide. Because as a journal, they would think that there's someone expert involved in that, so in that case your review would be easy to get published in that scenario. Specifically, I would suggest, for example, I did a review on COVID itself and I got it published. I had a faculty also as the second author and as the corresponding author. And you give the corresponding authorship to the faculty, because in that case, then the journal feels that the expert is involved, and that gives a sense of the quality of the paper is better. But again, when it comes to research, if the quality is good, and always keep in mind, when it comes to research, the methodology adapted has to be correct. Even if something like there's one question which is commonly asked: I started with the study, I got wrong results. Suppose what the hypothesis is, it got wrong. But if the methodology is correct, that wrong result signifies that what you were thinking was wrong. So that is important for other researchers who might read your paper, and they might that might change the direction of their thinking. So for getting again coming back to your question, Sneha, just summarizing it: for getting a narrative review published, have a back of an experienced person in that specific field. Write a good quality narrative review by going through the checklist and everything. So all the important things are mentioned there, and then just go through it and proofread your narrative review again and again to get the best, or to make the write the best one. And again, even if there's not a faculty, try then there would be student journals still would be happy. Like student journals are more or less happy to get articles from students. So there is always a scope of getting it published somewhere. Yes, Mrigansh, you have a doubt?
Sir, for example, if I get a paper, I select a paper that I have to read this paper, and on first reading, I think everything is related to my narrative review. But in actuality, what all data should I target from that specific paper to
Okay.
write in my narrative review?
Okay, so you go through that paper. Also, remember that you cannot copy paste something from different papers. That would be plagiarism, right? So what you have to do, you have to read it. You have to paraphrase it in some way. You have to understand what it is saying, and then write it in your own words in the narrative review, making it relevant to what you are already writing. Now, see, everything from a paper need not to be written. For example, I am in the next statement, I'm writing about some adverse effects of HCQ. I'm writing about HCQ. I like, how do you write an answer, right? You start with an introduction. You tell about what are its uses, what a little bit maybe about the history on how HCQ came into the picture, how we started with using HCQ, how effective it came out to be. When you're saying how effective it came out to be, you only need the data. Then you conclude about, but in these many patients, so side effects were seen. So when you are finding the relevant paper on adverse effects, you'll only use the enumerate one line about the adverse effects from it. When you're getting a paper on containing statistical data on the how effective it was, you'll only use that particular line or data from that, right? So you only take the relevant things, like pick it from different places, put it into a funnel, and just paraphrase it, understand it into a single paper.
Thank you, sir.
Yeah. Thank you so much, Prigansh, for the question.
Hi, Pratyush. This is Martin. So it is a great session. Thank you so much for the insights. So I have this question, like with respect to original researches, generally when we phrase a research question, we are asked to do it in a unique way. Like it has to be different from what is already been in the literature. So in the narrative review, should it be something like that, or can it be like a summary of what has already been done?
Okay.
Like, is
So,
our publishing like affected by it?
all right. So see, the topic has to be new. What I meant by understanding of the topic, that you have to keep it a little innovative and new. And again, a narrative review is a summary of what is already there in the literature. But things are scattered there in literature. Your paper should bring all of them together to derive one single conclusion. That is the significance of a narrative review in that sense. Things already published articles, so how your narrative review is going to be unique? It is going to be unique because some paper talk about some different things, some paper talk about some different but related things. So you have to correlate those points, join the dots, and bring them together at one place. So if someone is referring, he'll get all the relevant information at a single place. So that's it, more or less about it.
Okay, thank you so much.
Right. Any other doubts? All right.
Okay, so I guess we can close the session now. It was a great session indeed. Thank you, Pratyush. Aspar was glad to have you.
Thank you so much, Aspire, for organizing this and calling me for to speak on narrative review, specifically a topic which is more and less ignored in terms of an original research in the
Yeah,
Indian scenario. So thank you so much for selecting it and calling me here. Thank you.
yeah. Thank you. There you stop the recording. Thank you.